Hey, welcome back. Today I'm going to teach you some exercises to help you with your neck tension. Now, when it comes to neck tension, what I always hear from people is that they didn't really know what to do about it except for some traditional stretches where they kind of crank on their neck, and sometimes it makes things worse, or other times it might provide a little bit of temporary relief, but it doesn't seem to have any lasting effect. So today we're going to take a much different approach, and I'm excited to show you. Are you ready? Let's get into it. This first exercise is called a sliding nod. I'm going to show you from a side view. Here's the idea. You can do this standing or seated, but you want to make sure that you start in a nice tall position. So lengthen up through the crown of your head. From here, take your head and your neck, flex forward as far as you can. Then take your chin, tuck it so that you're making a double chin. Now maintain the double chin as you slide backward at an upward angle until you arrive back at your starting position. So when you do that, you'll actually feel a gentle stretch on the back of your neck and basically at the base of your skull. Okay, so again, lengthen up to start, flex, tuck, make the double chin, slide. Okay, now as you do this, it's rather intense, right? There's a lot of contraction of muscles happening, especially at the bottom of the movement where you tuck your chin. Make sure that as you're doing this, and especially as you're sliding back at that upward angle, that you're only moving your neck, because we're trying to independently mobilize the cervical spine. Oftentimes what people do is they go to slide and they move their lower back. And that's actually a really common compensatory thing that happens when people have neck tension or pain. They will often use their lower back a lot more for some of the movements instead of actually moving their neck. So let's look at this again. Lengthen up. I'm going to flex forward, tuck my chin, and now as I slide back, keep it all neck movement so that your lower back and mid-back doesn't get involved. Imagine that you're in a bucket of cement all the way up to the base of your neck, like at shoulder level. Nothing can move below the area that is supposed to move. That's really going to help you dial in some isolated movement to the neck. From this angle, lengthen up, flex forward, tuck, slide back. Okay, so when you get comfortable with this, it doesn't have to be done so methodically. It doesn't have to be step 1, step 2, step 3. You can actually flow it together. And so what ends up happening is the motion is more of a wave-like action. So I would flex, tuck, slide. Flex, tuck, slide. Okay, and that can be something to kind of work up towards. Oftentimes I actually go back to the first version that I showed you that is more methodical, because I'm trying to get a really, really precise mobilization on the neck. So you can do it that way if you prefer. Just make sure that as you're doing that, the low back's not moving, the mid back's not moving. We're looking for isolated movement of the neck. And the last thing that I'll say, just so that you can kind of be aware of this, is sometimes people will clench their jaw when they're working on neck mobilizations. So 2 things to consider. Number 1, don't clench your jaw. Number 2, you want your tongue to be in the correct resting position. I know that sounds weird, but you want your tongue to be against the roof of your mouth. And that's not the tip of your tongue, that's actually the whole belly, the whole surface of the tongue should be slightly elevated so that it's in contact with the roof of your mouth the whole time during the mobilization, and your teeth will just barely be apart. And it's really important to consider that, because you don't want your jaw clenching, and you don't want your face muscles kind of contracting as you're trying to do this. We want this to be nice, independent movement that is coordinated from the target joints, which are in this case the cervical spine. Next, we're going to try a nerve mobilization for the accessory nerve. And the accessory nerve is a very important nerve for neck function. It supplies both the upper trapezius muscle and also this big muscle here on the front of your neck, referred to as the SCM. So let's give this one a shot. With nerve mobilizations, what you need to know as far as a safety consideration goes because we're going to be putting the nerve under tension, and you will feel that as kind of a radiating stretch, it's really important that you keep it pretty much as gentle as possible. I always tell people maintain a 3 out of 10 in terms of the intensity that you might feel. And as long as you do that, you're in good shape. You just don't want to ramp it up over a 3 out of 10 because nerves don't like to be aggressively stretched. We want to keep it gentle. So let's do this. I'm going to perform this accessory nerve glide on my right side to start. So I'm going to drop my right arm by my side, keep it relaxed. And the first thing to do is to take the whole shoulder, meaning the shoulder and the scapula, and you're going to draw it down and back. So I go down and back, meaning like pull my shoulder blade towards my spine. And I'm going to hold that position. From here, I lengthen up nice and tall through the crown of my head. I'm going to slide my head and neck forward, kind of like into a chicken neck posture. And then I'm going to tilt my head away from the target side. And I feel the stretch now. It's kind of a radiating stretch going from my neck all the way into my shoulder area. Now, once I'm in this position, we have to drive the mobilization. And we're going to do so by gently elevating our shoulder and then depressing our shoulder. So I'm just pulsing it up and down, but I'm still maintaining the entire tensioning sequence that we went through. Okay, so I'm going to shake that one out and show you from the side because I know that it's difficult to kind of see what's happening when you look straight on. So back to setting it up again on the right, draw the shoulder down, pull it back, hold that position. From here, I'm going to slide my head and neck forwards, tilt away from the target side. Now I feel the stretch. I'm going to keep it gentle, and we drive it by pulsing the shoulder up and down. Now you may notice that when you lift the shoulder, the stretch kind of goes away. You don't feel as much tension. When you draw the shoulder back down, it returns and it kind of ramps up the tension. So that is that feeling that is associated with mobilizing the nerve. Okay, usually 8 to 10 pulses is a good place to begin. You don't need to normally do more than that, okay? So it's already starting to feel good for me on this side. Now I'm going to go through the same thing on the left side so that you can see the steps on my left arm. One of the things that I just wanted to add here, and I'll show you again from the side, is that when I draw the shoulder down, back, okay, I'm going to take my head, I'm going to slide forward and tilt away. Now sometimes people won't feel the stretch very much here, and at that point you can explore maybe rotating the head away from the target side a little bit, sometimes even dropping the head and neck a little bit and rotating it away. So you can steer this a little bit if you're not feeling the sensation that comes with the nerve tensioning. But most of the time, gliding the head and neck forward and tilting away is enough to feel that at that 3 out of 10 intensity. Okay, so here we are. And now I'm in position and I'm going to pulse at the shoulder. Now, as I'm pulsing at the shoulder, I'm still actively pulling my shoulder blade back. I'm not losing that piece. And I'm still actively gliding my head forward and tilting away. So you do have to put some effort into this in terms of, contracting your muscles to maintain that end range of motion, provided that you are in the position and the mobilization intensity is gentle. Remember, that 3 out of 10 is really key. Now, just wanted to add that if you get into the position and you don't really feel anything at all, because that sometimes happens, nerve glides are different for everybody, right? Everybody is going to kind of sense it a little bit differently. Sometimes people have high levels of neural tension like me. I really feel these mobilizations quite aggressively. Other times people have to work on getting into the position deeper because they don't really feel it very much. But just understand that even if you don't feel very much, you still want to try this and then reassess how you feel afterwards, because you can still get a great benefit from it because the nerve is still under tension and you're still mobilizing it. So keep that in mind as you're practicing this accessory nerve glide. Okay, I saved the weirdest for last. We're gonna do an exercise for your eyeballs. Now, believe it or not, there are direct neuroanatomical connections from your eyes to your neck, so exercising your eye muscles can be super helpful in helping to relieve pain, stiffness, and tension in your neck. Now, before we get into the demonstration here, I do want to tell you that at any point, if you're practicing this exercise and you build up any kind of unwanted strain on your eye muscles, that would be your cue to stop, because sometimes people can be a little extra sensitive to these types of vision exercises. However, this is really simple to do. So you're going to be either standing or sitting, and you can lengthen up nice and tall so that you're in good posture. You're going to take your finger, which is going to be your visual target. We normally call these pencil push-ups. So if you have a pen or a pencil, you can actually hold that in your hand and look at the tip of it as your visual target. But here's the idea. I place my visual target out in front of me at an arm's length away at the same level as my nose. I'm going to look at it, and I'm going to follow my target in towards the tip of my nose and then back out again. So as I follow it in, my eyes are converging, coming together as they look at the target. And as I follow the target back away from me, they're diverging. So you want to move kind of slowly to make sure that your eyes are cooperating and doing what they need to do, and making sure that you're keeping your gaze fixated on the target the entire time. And the idea is to really just use a range of motion that's comfortable. I'll show you from the side so you can get a sense for what I mean here. The standard, when we teach this drill to people that really need it and they need to do some work, normally what you see is people will follow the target in, they get to about right here, and then they tell you, you know what, my target's starting to split into two. Boing, that kind of thing. And we don't want that. So number one, if your target starts to split into two, that means you've gone a little too far. Okay, and you want to back off on range of motion and regress it a little bit. The idea would be to be able to eventually follow the target all the way in to the tip of your nose and back out again. And you'll feel that that last 5 inches can actually take a lot of effort. Like, you will feel your eye muscles working really hard to pull inward to follow that target. You will notice that the target at that point will become a little fuzzy in those last couple inches. That's okay. But again, what you don't want is the target splitting into two. The whole time I'm breathing, staying relaxed, maintaining good upright posture, and just really focusing on the target, making sure that both eyes are coordinated as they follow the target. Believe it or not, sometimes people have different levels of like convergence issues, and they'll follow the target in, and then all of a sudden one of their eyes will go whoop, and it'll like kind of look in the distance almost. It's like it just is kind of staring and not really looking at the target. Sometimes that will happen. If you're really interested to see what your eyes are doing, just set up your phone and actually video them. You do want to make sure that both eyes are coordinated together, following the target in and following the target out. If you do feel anything funky happen with what your eyes are doing, then you just want to maybe reduce the range of motion or reduce the speed that you're moving the target, and you should be in good shape. So after you try this one, roughly, I don't know, it could be as low as 3 repetitions all the way up to 10, depending on how you're feeling. Remember, you don't want to feel unwanted tension, so kind of pick a rep range from 3 to 10 that is comfortable. So there you have it, 3 high percentage exercises that will hopefully help you with your neck tension. Now, if you like this kind of concept of taking applied neurology and blending it with movement, then certainly subscribe to the channel, but also check out the Kruse Elite podcast, because I go deeper into applied neurology and how we blend it with movement. If you like this video, give it the thumbs up, and don't be afraid to comment, especially if you have questions. Thank you so much for watching.